My name's Dearbhail. I am a consultant liaison psychiatrist based in Belfast Health and Social Care Trust. So I have been in this post since 2013, and our team provides liaison psychiatry services to all patients over 65 across 4 acute sites in the Belfast Trust. So we're quite a small team. There's myself and a liaison nurse and a psychiatry trainee, usually a senior trainee. So it's quite busy. There's quite a high demand on our services for patients across the trust's 1,800 beds. So it is a busy job, but a really enjoyable one. And what I like about the job is its unpredictability. I don't know who I'm going to be seeing, what site I'm going to be working in day to day, but that's something that I enjoy. And with that, unpredictability there comes a degree of flexibility as well, which is important to me to make space for some of the other non-clinical roles I do in medical education. So when I started medical school, initially I actually wanted to be a pediatrician, but the summer of in between first year and second year of medical school is what changed my mind. So during that summer, I worked as an occupational therapy assistant on a rehab ward in a local psychiatry unit, and that was my first experience of working with people who had severe and enduring mental illness. And I really enjoyed the experience and began to think of psychiatry as a career. So throughout the rest of medical school, I really enjoyed any opportunity that I had to learn more about psychiatry, about mental illness. So my interest really increased as I went along in the clinical years in medical school. So when I completed my PRHO year, which was in the Royal Hospital in Belfast, I really couldn't wait to leave physical medicine to embark on psychiatry training. And the irony is that that's where I'm currently based in my job as a liaison psychiatrist. So I have, throughout my training, I did enjoy all psychiatry training posts across a range of subspecialties. And I think that that's one of the things that has been important to me in my career is that psychiatry opens up lots of different specialties to suit everybody, really. There's such a range of choice of specialties, and liaison has definitely been the right one for me. I can't imagine myself working anywhere else at this point. So as I've mentioned, I think there is something for everyone within psychiatry. Psychiatry affords people the opportunity to work across a really wide variety of settings, to work with diverse groups of people, and to gain expertise in a very wide range of conditions. I really enjoy the fact that we're able to spend such an amount of time with our patients to get to know them as people, perhaps more so than doctors and other specialties do. And I have to say, one of the really important things for me and why I would recommend psychiatry as a career is the job satisfaction that comes with it. I really don't think there's anything better to hear from a patient than "I feel better after talking to you." And I think working in liaison, when we are often the person who perhaps spends most time with that patient in a very busy clinical setting, liaison really affords people the opportunity to make a difference. So it's definitely one of the things that I enjoy most about my job as well. And I do think that psychiatry offers um, the opportunity to gain expertise in other non-clinical areas as well. So, for example, I have roles in medical education, which I really enjoy. The interface with the legal system, so working in liaison, I'm often asked to assess patients' decision-making capacity. So that's another aspect that gives me huge job satisfaction, and the opportunity to get involved in staff experience. So that's one of the other things that I do that I really enjoy in my job is working as a clinical lead for Schwartz Rounds, which is a reflective practice group. So I think in summary, psychiatry offers really diverse career opportunities and a great degree of job satisfaction and the opportunity to develop loads of interests that complement your clinical work. Yeah, I certainly am. I think for me, training was a positive experience overall. I definitely found the exams a challenging experience, juggling work, juggling on call, and trying to find time to study amongst all of that as well. And I did do my exams before having children, and I'm really in awe of trainees who manage to study whilst juggling other demands, like that, like childcare as well. I do think any pressure to progress probably came from me rather than from consultants that I was working with at that time. And I did work less than full time for a period of time, which I suppose at that time in my personal life when I was a new parent was really valuable to have that opportunity. And I think probably psychiatry is one of the specialties where less than full-time training has been really well established. And certainly it was a factor in me being able to continue my training, and to complete my training and to be in the position that I am at the minute.